Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
Absolutely, Bob. Absolutely.
We're going to try today to unwrap.
in our opinion, of course, I'm supposed to say.
Yes, there
Sorry.
we go. We're going to try today to unwrap a mystery. So if you're female and you're out there and you have long-standing back pain, or not even long-standing back pain, but you can't figure it out,
Yeah.
like you're a mystery, this may help you. We're going to go over some unusual cases here.
Right. And this
actually not that unusual.
This is not a sexist thing. There's
No.
a lot of science in this, and it's very.
We'll go over why the reason this occurs. Is there a giveaway, by the way?
Oh.
C2. The massage gun.
Yeah, you know, I actually like the massage gun for this particular diagnosis, but not. I'm not a woman.
Sure.
There it is.
Obviously.
Bob and Brad massage gun.
Yep. Go to bobandbrad.com, go to the giveaway section and sign up for it. And you'll love it because it's got 5 attachments, 5 speeds. It's got percussion. It's got power. It's got utility.
Yeah.
Anything else, Brad?
It's a beautiful. It's got our names on it, but it is. It's a really good quality gun.
All right. We got to get to task on hand here. All right. So I had Dr. Abbasi on. He's a neurosurgeon, very smart guy. And he said they found out with research that 22% of the patients who are coming in with back pain is actually an SI problem, sacroiliac.
Right there.
Yep. I'm going to show it on here too, Brad.
Yep.
So if this is your spine, and this is the sacrum.
Yep.
It's kind of a triangle-shaped bone, and it's attached to the
nerves out.
Yep. It's attached to the sacrum, and it's attached to the pelvis.
Right. So here.
The iliac.
Yep. You can see how we're moving. There's a joint there and there.
Yep.
And the problem is these joints become unstable.
Right.
And they're not really meant to move a lot at all.
No, they aren't. And they actually, because there's nerves that go by it, they can send pain all the way down your leg. That's what throws the doctors off, Brad.
Right.
They come in and they go.
Similar to sciatica.
Yeah, they think sciatica, but they look at the low back and there's no problems. And we're going to go over the the signs that you might have this.
Okay.
And hopefully it will help you because it is called the chameleon joint. Because it's like chameleon. It's weird.
Yep.
So
fake you out.
A typical patient, it's often female. It's she often recently gave birth, and that makes sense because when you give birth, these ligaments become lax, so that the baby can come out the canal.
Right. Yep. So then things spread, and there is movement going on in those cases. Oh my goodness, we lost a sound. So yeah, so that's why this is more of a female issue because of
it often
hormones.
hurts going up and down stairs, which makes sense. The person often is a runner, which also makes sense.
Sure.
Got some pounding.
The impact.
I also just recently had a patient who fit in this category, and she was only 17. Obviously, she did not have a baby, but she was super flexible. She could easily do the splits either way, sideways.
That's kind of a genetic thing with her.
And her mom, who was 47 years old, could still do the splits.
Yeah.
So
runs in the family.
She was lax in that SI joint. She also had pain all the way down her leg. So
the
again,
mother did?
No, the daughter, and so the doctors were perplexed, and leave it to Bob and Brad to solve the problem.
Yes,
right?
Well, there you go again. And actually, Dr. How do you
Abbasi.
Abbasi, yeah. He lives only
few
hours
he's
from
up in the Twin Cities. So what they do to make sure, the other thing, Brad, I was going to mention is when you turn in bed, they often have pain.
Sure.
So and again, the pain can go all the way into the foot. It's actually another situation, Brad, where you might see it is in somebody who had a fused back. If their back was fused, now the movement's got to come from somewhere, so it goes more into the SI.
So typically, if it's fused as a result of surgery because they
Right.
had back problems, not necessarily. You
Then
could have something
the
else.
number of people who get it then is 43%.
Yeah.
So a lot higher.
Mhm.
So how can you tell whether or not you have this? Well, first off, do you have any of the history that we just mentioned?
Right.
I'm going to show you one test you can do. This is a Dr. Bossy test.
Ah,
He made it up himself, actually. Yeah, Brad, you probably might be better there.
should I show it from this angle?
Yeah.
Yeah.
Let's say you're having pain on the right side. You're going to take that right foot and try to place it onto the right ankle. Now, if you are right knee, if you can't even do that, that might be a sign that you're having SI problems.
Yeah. And test compare to the other
Right.
side as well. Especially if there's no pain on this side, it can give you some information.
So you put the knee up, and then you actually push down and you try to relax better while you're pushing down.
Let me get some good posture here, and so gently, and it's a positive test
If it
hurts.
it recreates the pain that you've been having.
So it might hurt here, and you might feel it go down the leg.
Yep.
It recreates your pain, if you want
Right.
to call it that.
Now, there's other tests the doctor can try, but the most conclusive test they do is they actually inject the joint
Sure.
with usually a little cortisone, and if that takes away, even if it takes away for a couple days,
Yep.
it's proof that it was the SI.
Yeah. It specifies that joint.
So if it is the SI, the cortisone might help. It might actually take it away for good for several years.
Sure.
Or there's actually a surgery they can do where they actually fuse the SI.
Sure.
So
There's the conservative way. We do have a book of a
Right.
therapist who specializes in SI joint, and it's oftentimes
Yep.
for women.
so you can look up Bob and Brad SI or sacroiliac,
Yeah,
and
SI joint.
we will have some treatments you can try.
Right.
So, Brad, do you have anything else to say?
No, not at all, Bob. But
I
yeah,
like your haircut, by the way.
well, you didn't. So what for surgery they do? They inject into the joint.
Right,
actually
but for real surgery, they actually fuse.
Oh, really? I thought they injected a compound or a
They
medicine
do.
that actually, in a sense, fuses it. But
No.
no.
Nope.
Oh, I was
Absolutely not.
misinformed or
Yep.
misunderstood it.
So if you want to go to an expert, see Dr. Bossy, you can go to his website, inspiredspine.com.
Inspired,
Yep, Inspired
Inspired,
Spine.
like you're inspired. Okay.
Yep. He is the man on
Yeah,
this. So
he has a private clinic, and that's all they do is back treatments and these really impressive surgeries that really do not.
not less invasive.
Right. Yeah. The
So,
spine one was amazing too.
Yeah.
How
And he
little-
called it the magic joint because women would have pain for years and they walk out of that surgery without any pain.
Yeah, that is
So-
magic.
That is magic. All right. Thanks for watching.